everyone. Um, my name is Tryngolza. I'm going to talk about a recently approved medication. It's a new medication that's out in the market. It's called Tryngolza Olezarsen injection, and its mechanism is pretty interesting, which we're going to discuss in a moment. But just by looking at the image here, it looks like it is an injectable, looks like an auto injector here, and it's for subcutaneous injection. So it's given subcutaneously. You can see a dosage as 80 milligrams per zero point 0.8 ml. Um, so um, this particular drug is not commonly used in every patient. It has, but it is a very important drug for some specific patients who have uh, a specific type of genetic disorder. Specifically, um, these are specifically targeted for patients with high triglyceride levels, regardless, um, uh, you know, when they have like a genetic problem and like no other medication is working to reduce it. So this medication works in a way to help lower those triglyceride levels, specifically with those who have over 500 milligram per deciliter, and that could also contribute to pancreatitis. So that's why um, it's important to uh, try to lower the triglyceride levels so it doesn't affect the pancreas either. So we're going to talk about um, the mechanistic approach and how this works and all. Um, I feel like you all should know a little bit about this. So um, it was just recently approved around just about 4 days ago on June 24, 2026. Um, it's mainly used to reduce the triglycerides and risk of acute pancreatitis. It's given subcutaneous injection, as you saw in the picture. Um, and like I mentioned, it's used mainly in patients who have this familial chylomicronemia syndrome, which is a rare genetic disorder where the body cannot break down triglyceride-rich lipoproteins, chylomicrons, which are essentially like um, that those kinds of particles that carry that triglycerides in the bloodstream. And what happens is the liver um, produces an enzyme and um, lipoprotein lipase to break down that triglyceride from the blood. However, when a patient has this kind of rare genetic disorder, there is a less of a chance that um, this can um, this process will occur. So the medication is made in a way to help uh, lower this triglyceride-rich lipoproteins. Um, so if a patient has this syndrome and it continuously develop high triglyceride levels, some of the symptoms you'd expect a patient may have are things like abdominal pain, yellowing of the skin lesions. They might have some fat in the eye, or triglycerides in the eye and all. so lipemia retinalis, and enlargement of the liver and spleen may occur too. So these are some of the symptoms for a patient who has like familial chylomicronemia syndrome. We can break down those triglyceride levels um, naturally in their body. So we're going to look at the mechanism here. I have an image here, start us off. You can see a picture of the liver here. And then with the liver, I kind of drew a circle in there in orange to show a liver cell or hepatocytes. Um, and there's an mRNA that's somewhere in the cell, and you have the drug also. Now, this drug binds to a ligand that's chemically modified in the manufacturing facility that actually allows the drug to get inside um, the hepatocytes or the liver cells. And then it will bind to the mRNA, kind of modify or programmatically modify the production um, of the ApoC3 or apolipoprotein C3. So basically, the purpose of this medication is to decrease the amount of ApoC3 for in the liver so that it doesn't um, so that it will allow more of a decrease. It will allow decrease of triglycerides that are in the bloodstream. ApoC3 will essentially prevent the decrease of the triglyceride in the bloodstream. So by decreasing the production, it will allow uh, the triglyceride levels to get much lower. So that's essentially the goal here. And so that's essentially what this image is showing. You can kind of see a bloodstream with some fats and chylomicrons um, flowing the green little dots, kind of like triglycerides. I kind of have the drawing for your reference. And you can see how ApoC3 is kind of preventing it from getting taken in by cell and be broken down by the lipoprotein lipase. So um, that's why this medication is there to um, halt the production of ApoC3 so that triglyceride levels can be reduced and patient can live normally or happily. So this is the breakdown in terms of the description words. Antisense oligonucleotides that target mRNA for ApoC3. That's essentially what the drug is. It's used as an antisense oligonucleotide. And the ApoC3 inhibits the lipoprotein lipase activity and slows the removal of triglycerides from the bloodstream. Hence, the medication reduces ApoC3 production in the liver and significantly lowers triglyceride concentrations. So that's what this does. And it's modified by this ligand here. You could see it here. And binds to this ASGPR receptor, and it allows the medication delivered inside the liver cell. And then it decreases the triglyceride-rich lipoproteins from bloodstream. So that's pretty much it on this medication topic. So if anyone has any questions, please feel free to let me know. I hope this was uh, useful and information to you all. We will continue to have more information on other medications as they get approved by FDA, posted as soon as we learn more about them. Feel free to comment subscribe, you know, leave any type of feedback you'd like. Um, so, and these videos are going to be posted, um, and it will always be available to you all whenever you need to um, learn more about these medications. So feel free to let me know if you have any questions. Thank you, and have a good day.